play therapists, we know that goals are important in the process. We know that setting goals, tracking goals are essential in order to understand what the child is experiencing, how we stay on top of understanding if they are making progress, et cetera, et cetera. What we may not feel really skilled in, though, is how to create a great goal and what even the ingredients are to create a great goal. So before I explain to you three things that we can use to help us create a great goal, I wanted to remind us why we're even creating the goals in the first place. And I already just said one, which is that we use the goal to help us as the clinician be able to track the progress that the client is making. It's kind of our benchmark to be able to understand how is this client actually doing. The second one is it's also important so that we know what to communicate to the parents and caregivers about. It's also where we help them be able to recognize that their investment or the time that they're putting into this process is actually useful, that there is an outcome, that it's a successful investment. So the goals are used to help the parents understand what we're doing, to keep them invested, and it's also used to help us understand what the child is doing relative to what we are working on therapeutically. So the three things, I want to give you the three main things to think about when you are setting up these goals. The first one has to do with making sure that the goal is age appropriate. So as an example, if you try to create a goal that sounds like this 5-year-old is going to stop hitting. Well, 5-year-olds sometimes hit. So likely you're not going to be very successful in that goal. If you have a goal that says we're going to stop the temper tantrums and this child is 3, likely not going to be very successful in that goal. Or the 4-year-old, they're going to be able to talk about their feelings instead of sometimes using their body to communicate. Well, that's a skill that takes some time. And a 4-year-old's probably not going to be very masterful at using their words and being able to describe why they're mad all the time. So age appropriate is important. Sometimes we set a goal that's not age appropriate, and we're setting ourselves up to not be able to accomplish the goal like right from the beginning. The next one has to do with being realistic. And when I say realistic, I mean it's not an all or none type of a thing. Human beings are not all or none in our behavior. We're a bit more colorful, a bit more gray than that. And so I'm a real fan of using words like increase and decrease. So rather than setting a goal that sounds like the child's going to stop hitting, that's all or none. Sometimes the child may still hit, but what we can do is decrease the child hitting, the amount of times the child hits, or we can increase the child's ability to use their words to describe that they're mad instead of hitting, or something like that. So using words like increase and decrease really provide the flexibility to be human. That's really what that boils down to, because we're human. And then the third one has to do with making sure that you know how to measure it. Now, I'm not talking about things like 8 out of 10 times the client will demonstrate. I'm not talking about that kind of measurement. I'm talking about what are you looking for behaviorally that's going to indicate that that goal is actually happening. I'll give an example. If I were simply to say the child is going to decrease their anxiety, what does that look like? I have no idea what that looks like. I have no idea what to track. But if I said something instead that sounded like I'm going to decrease anxiety, and the way that I'm going to know this, let's say that the child had a pattern of clinging on to the parent's leg as they were being dropped off at preschool, and they would get highly, highly anxious in those moments, we might track that and we'll know that it's decreasing because the child will be able to let go of the parent's leg a little bit easier. So those are really the three things when you're thinking about goals. Is it age appropriate? Is it realistic, meaning it's not all or none? And do you know how to measure it? Do you know what you're looking for so that when you're having those conversations with the parents, rather than saying things like, how's the anxiety going? Or is it decreasing? The parent may or may not be able to answer that or orient to that type of a question. But to be able to say something like, how is your child doing with letting go of your leg a little bit easy, a little bit more when you're dropping your child off at preschool? The parent or caregiver now knows what to orient to. So goals are important. Yes, they are. It's important that we set them with parents and caregivers up front. It's important that we review them. It's important that we track them. And hopefully those three tips will help you create them in a way that sets you up for success.